Right. So, Dr. Cho and Linda, you ready to go?
Yes, I am.
Okay. Dr. Cho?
Yeah, let's go.
Okay, good afternoon to everyone. My name is Linda Joseph Messiah, and I'm pleased to welcome you to this afternoon session, Debunking Common Myths About Type 2 Diabetes. I am the Health and Temperance Leader at Berea Seventh-day Adventist Church, located in downtown Toronto. And the welcome today is not only from myself, but from the leadership of the church that is led by Pastor David James and a number of our members. We're hoping that by coming to this session this afternoon, you will learn some interesting facts about how your lifestyle can reverse diabetes. At this time, we'll have prayer by Elder Cook.
Let us pray. And our God, our Father, which art in heaven, hallowed be your matchless name. We thank you, O God, for being a God of one of such that always looking out for our best interests. We thank you that you have wake us up this morning and you have provided us with a portion of health, and we can come and convene in this manner where we can learn even more how we can be able to deal with and take care of ourselves. I know it is in your best interest because you said in your words, you wish above all things that we prosper and be in good health. So we just want to thank you for the Health and Temperance Department and for the doctors who are take this opportunity to make this presentation an educational one for us. I pray, O God, that we will be benefit and blessed from it. May we have no interruption. May no one interfere or intervene. Because when it's all said and done, we want to be edified and we want to give you the praise and the glory. So I pray and I ask all these mercies in Jesus' precious name.
Amen.
Okay. Thank you, Linda, and thank you, Mr. Cook. My name is Dan from Lifestyles Medicine, and we want to thank the Seventh-day Adventist Church for partnering with us. We partner with them on many of these online events. The Adventist Church is well known for health and promoting plant-based eating as part of their faith practice, and also recognized one of the longest and healthiest people groups in the world. So just really appreciate the Adventist Church for partnering with us. So yeah, as Linda mentioned, our topic today is debunking common myths about type 2 diabetes. For those, some of you may have been at our previous session, which we had to reschedule because basically it got Zoom bombed. So we apologize for that, and we're really glad that you could join us for this one. Please do note that this session is being recorded, and we are also streaming on Facebook as well. So please just take note of that. So we're gonna have a presentation, and then after that, we're gonna have some questions. So we are talking about diabetes. We want to answer your questions about diabetes. So please share your comments as the presentation goes along, and also your questions, and we'll try to get through as many as possible following the main presentation. Also, please do note that this session is for educational purposes only, and please speak with your healthcare provider before, of course, you apply any of this information. Yeah, so I'm Dan from Lifestyles Medicine. We also partner with Pathways Lifestyle Medicine Clinics in Toronto. So you could check them out at pathwaystoWholeness.ca or call that number. And of course, as Linda mentioned, we're really proud to put on this event with the Seventh-day Adventist Church. Okay, so our speaker today is Dr. George Cho. He's a licensed naturopathic doctor and the clinic director at Pathways Lifestyle Medicine Clinics. He focuses on using evidence-based lifestyle medicine to help people prevent, treat, and reverse chronic diseases. He speaks widely throughout the community, and we're just really pleased to have him here. So Dr. Cho, we'll turn it over to you again. We're gonna have a presentation, and then after that, we want to get to your questions. So please put in your questions and we'll try to get through as many as possible. Thank you.
Hello, everyone. Hope you're all doing well. Daniel, could I share my screen?
Sure, 1 second.
All right, everyone. I hope you're all doing well, and thank you for coming out. Today, we're discussing a very important topic, type 2 diabetes. Probably everyone here probably knows somebody who has type 2 diabetes or is at risk, and the typical way of treating it is through medications and so forth. But we that are involved in lifestyle medicine, we believe that there are really good lifestyle interventions that can really help address the root cause of type 2 diabetes. So that's really what we're going to try to look at today. What actually is the root cause, or what's like the main driver behind type 2 diabetes? And the idea is if you can actually address the root cause, then perhaps we can actually heal from diabetes, not just manage it. So that's kind of the idea today. And just very quickly, I just want to share with you just mainly discuss nutrition and how healthy nutrition can affect type 2 diabetes, all right? And the approach that we're going to take today is basically try to address some of the common myths around food and diabetes. And I think we will start seeing a pattern emerge about what might be the healthiest nutritional pattern to adopt for those who have type 2 diabetes. And if you don't have type 2 diabetes, it's still relevant for you because we also want to prevent getting type 2 diabetes. And the good thing for us is that really the same nutritional pattern that reverses type 2 diabetes is actually the same one that helps prevent it as well. So hope you learn a lot. So let's go here. All right, so the first myth that we're going to address is that it's mainly genes. All right, so you probably heard this before, I've seen it in clinic as well. Person comes in, they have type 2 diabetes, and they say, mom and dad have type 2 diabetes, and also, grandpa also had type 2 diabetes, and therefore I have type 2 diabetes. So we're going to look at that, is it genes or not? All right. So here you see two groups of people. All right, they're both Pima Indians. All right, however, they're geographically separated. All right, so one group you see is the Pima Indians of Mexico. The other group that you see are the Pima Indians of Arizona. Same family, very similar genes, but geographically different locations. Now, what's fascinating about the Pima Indians is that these indigenous groups, they have, even though they're genetically very similar, they actually have very different rates of diabetes. It's very interesting. All right. So, for example, scientists have been studying the Pimas of Arizona, and they've been tracking the number of people who have type 2 diabetes over the last many decades. And I'm going to show you a graph here, and you're going to see that the prevalence of type 2 diabetes actually has gone up quite significantly among this group. Okay. So you see here 1908 all the way to 1965. And you're going to see here that type 2 diabetes is going up with every time they assess. So you see in 1908, they had one case. Then over the years, as you can see, the numbers go up. All right. Now, how about compared to their brothers and sisters over in Mexico? Are they similar or are they different? Well, we don't need to guess. The scientists have kind of looked at this. So you see here prevalence of type 2 diabetes, obesity, and also obesity among men and women. The blue is the Pimas of Mexico. Okay, so you see the percentages there. Now I'm going to show you the a comparison between them and their brothers and sisters over in Arizona in red. And you can see that the Pimas of Arizona have drastically higher rates of type 2 diabetes, obesity, and so forth, okay? So there you go. So you can see it's a major contrast, right? The Pimas of Arizona have way higher rates of type 2 diabetes and obesity. Look at the women, 75% of the women, the Pimas of Arizona, the women are obese. That's really, really high. So the question is, what happened, right? Because again, genetically, they're going to be very similar. So what happened? How come there's such a big difference? All right. Well, this is what happened. Back in the day, they decided to urbanize things, and they decided to build a massive dam across the river there, and basically this destroyed the traditional way of life for the Pimas of Arizona. And so pretty much they stopped farming and they moved onto the reserves. And whereas before they were very physically active, they became very sedentary. All right, and these lifestyle changes is what drives this change in the rates of type 2 diabetes. On the other hand, in Mexico, the Pimas are still generally maintaining their traditional way of life. They're farming, they're very physically active. All right, so it's a lifestyle that's changed. It's not really the genetics. All right, so, and I'm not just making this up. Scientists say this themselves. So you see here a quotation from a report discussing the Pimas, and this is what they say. These results indicate that even in populations genetically prone, so notice the words here, genetically prone to diabetes and obesity, their development is largely determined by environmental conditions. All right, so which environmental conditions? Therefore, we concluded that the transition from a traditional to a modernized lifestyle is associated with diabetes and obesity. Now notice the next words, regardless of genetic predisposition. All right. So simply put, what they're saying is this. You can be genetically prone to getting type 2 diabetes and obesity. Right? You may even have a genetic predisposition. But really what actually pulls the trigger here is actually changes in lifestyle. That's what they're really saying. All right. Now, it's not to say that genetics does not matter. Of course, genetics plays a role in everything, right? But what is really the main driver? That's the real question. So, I think we can safely say that type 2 diabetes is really driven by a change in our lifestyles, sedentary behavior, and also a change in our dietary patterns, lots of refined foods and lots of animal foods. I think this is really what's behind the type 2 diabetes epidemic that we're seeing today. Some of you might have seen this, but I think this really sums up the situation well. Genetics loads the gun, but lifestyle really pulls the trigger. All right. So some of us are going to have me genetically predisposed, perhaps because of mom and dad or so forth. However, just because you have genetic predispositions does not necessarily mean that you're actually going to get type 2 diabetes, at least in the vast majority of cases. Right? It's really lifestyle factors. All right. And this should actually be very encouraging to most of us because it tells you that you might actually be able to do something about type 2 diabetes if you have it or if your loved one has it. That by changing lifestyle, maybe we can actually improve the situation. All right. Now, myth number 2 is that type 2 diabetes is for life. Okay. How many of you know somebody, a loved one, maybe even yourselves, and you've been told that you're going to take medication X, Y, and Z for life, right? So we have to look at, is this actually the case? Is diabetes for life? Or can you actually reverse it? That's a question we need to ask ourselves. So let's take a look. This is Dr. Roy Taylor. He's a researcher over there in the UK, and he did some very interesting landmark studies on type 2 diabetes. And I want to share with you some results which shows that actually type 2 diabetes is a reversible condition. All right, is a reversible condition. So first, Dr. Taylor noticed some very interesting studies. There are these people, researchers who are getting people with obesity, and they had type 2 diabetes. And they're getting these individuals to undergo the surgery that you see here on the screen. Basically, it's gastric bypass, which means you staple the stomach and the food goes from your esophagus, and instead of going into your stomach, it goes into your intestines. Pretty much this is a way to basically decrease caloric intake and therefore make people lose weight. All right. So, but what they noticed was that obviously people lost weight, but as a side effect, a lot of these individuals actually reversed their type 2 diabetes, something that they really didn't think could happen. So this was very interesting to them. They said, what is it about these people that are undergoing these surgeries that's actually making them not just lose weight, massive amounts of weight, but also reverse their type 2 diabetes. And so initially they thought maybe it was a surgery. Maybe there's something about the surgery. So this led to the widespread belief that surgery itself brought about the specific changes that led to the reversal of type 2 diabetes. But Dr. Taylor here, he makes a very interesting observation. He says, this reasoning overlooked the major change that follows bariatric surgery. Okay, notice the next words: an acute, profound decrease in caloric intake. All right. So basically, what Dr. Taylor is arguing here is that there's nothing magical about the surgery. Basically, the point was that the surgery led to something else, which is a decrease in caloric intake. And so that with the weight loss, it was actually what was driving the reversal of type 2 diabetes. All right. So they say, so can we actually get the same results without making people go through this surgery? Because, it would suck if everyone who has type 2 diabetes would have to do this surgery. I mean, that would really, really suck. So can we get reversal without the surgery? All right. So what they did was they got individuals with type 2 diabetes and they put them on a very low calorie diet. All right. And lo and behold, they saw reversal of type 2 diabetes. And I just want to point out, it wasn't years later. This is within months. For some folks, it was actually within weeks of reversal of type 2 diabetes. All right. And what they noticed here was that the more weight that people lost, pretty much the greater percentage of them actually reverse their type 2 diabetes. All right. So you can see here, with more weight loss, the greater percentage reverse their type 2 diabetes. So those who lost 15 kilograms or more, 86% of them reversed their diabetes. These are numbers or percentages that you often do not see in clinical practice, but this is what Dr. Taylor found. All right. Now, this is key. Not only what they have found was that in the liver that they actually restored insulin resistance. All right. So everyone here is probably aware that in type 2 diabetes, your cells become resistant to insulin. All right. But what they found in Dr. Taylor's studies was that they could actually reverse the process so that your cells can actually become sensitive again to insulin, which is really, really fascinating. So the question is, what went on? What went on? Why did they reverse their diabetes? So let's take a look at what is going on in type 2 diabetes, and it will help us understand how lifestyle factors can actually help reverse, all right, type 2 diabetes, all right. Now, we don't know all the aspects, but we do know enough to kind of paint a picture of what is going on in type 2 diabetes. And this is perhaps one of the most important slides I'm going to show you, because often when people go to the doctors and so forth, they don't really get an explanation of what is actually going on inside their bodies. And so I hope that this will maybe help you understand some of the stuff that's going on when people get type 2 diabetes. All right, so here you have the liver, okay? And inside the liver, you see here, it's a very nice, clean liver, all right? And when that is going well, when it's a nice, clean, like you see on the picture, things function properly. So see here, insulin comes to the cell, it binds to the receptor, a signal is sent to this thing called GLUT4. You see on the screen, it says GLUT4. That is a transporter. GLUT4 goes to the surface, and lo and behold, glucose or sugar gets into the body. Okay, so that is working properly. However, when people have type 2 diabetes, often what happens is that you can see here, the liver is full of all this yellow stuff. The yellow stuff is fat. All right, there's lipotoxicity. Okay, there's fat. Now, when people have buildup of fat inside their cells, you see all the yellow circle that represents fat, things start to malfunction. All right, so the signaling isn't working, okay, to the GLUT4 receptor. And then therefore the GLUT4 receptor does not go to the surface, and therefore sugar does not go into the cell. I want you to notice here, everyone, that lack of insulin is not the initial problem. I hope everyone can see that. All right. Also, it might surprise you, but you can see here that glucose is actually not the initial problem. Do you see that? All right. Having too much glucose is actually not the initial problem. It's a result of the problem. All right. You have high glucose in your bloodstream because it can't get in. So the question is, how come it can't get in? Well, as you can see here, it's because of excess fat buildup in the cells. All right. When you have too much fat in the cells, you have inflammation and causes the signaling mechanisms to fall apart, which means that glucose cannot come in. So we have to realize that high glucose is a result of the problem, is actually not the problem itself, okay? I hope that is clear to everyone. Now, let's look at the pancreas. So on your left, you see the pancreas, okay? And the pancreas produces insulin, all right? Now, what's very interesting is that when you have lots of fat buildup in your liver, the liver says, you know, there's a lot of fat here. We have some extra fat. Let's package it. Let's ship it off to other places in the body. So lo and behold, it sends it to the pancreas. And so pretty much the same problems you see in the liver, you start seeing in the pancreas. And when you have fat buildup in the pancreas, then it messes up with insulin production. And so it's very interesting and very unfortunate that with type 2 diabetes, initially the problem is not too little insulin, but later on as the disease progresses, insulin actually becomes a problem, all right? And it's exactly because of what you see on the screen before you. And so later on, people with type 2 diabetes, eventually they're also put on insulin, when in the beginning, insulin was actually really never the issue. Right? So which is actually really, really unfortunate. But you can see here the underlying cause, though, as far as we can know from the science, is too much fat buildup in the cells, all right? The same thing happens in the muscles as well, all right? So this is Dr. Taylor. He says, type 2 diabetes has long been regarded as inevitably progressive, okay, which means pretty much it's going to progress and get worse and worse, requiring increasing numbers of oral hypoglycemic agents and eventually insulin, all right? So first they're put on one drug, then maybe they have to take another drug, and then eventually down the line, they're going to take insulin, okay? So in the past, they thought, you know, the disease is going to progress and you're going to have to take drugs for life, all right? But the good news is that it doesn't stop there. He says, but it is now certain that the disease process can be halted. Type 2 diabetes can be understood as a potentially reversible metabolic state precipitated by the single cause of chronic excess intra-organ fat. Notice these words. It can be halted. Okay? It is potentially reversible, and it is caused by chronic excess intra-organ fat. Chronic means long time, excess means too much of, intra-organ means inside the organ, and fat. Okay, so fat build up in the organs over long periods of time. All right. So this is really what drives type 2 diabetes, at least in many cases. All right, and it is reversible. All right. So too much fat, too much inflammation, then you get metabolic dysfunction. Therefore, the way to reverse type 2 diabetes is to reverse the process. You get the fat out of the cells, and which will then help restore healing in the organs, the liver and the pancreas and so forth, which then helps the sugar get back into the cells, and you can heal from this disease. And of course, where do you get the excess fat buildup? In many cases, in the majority of cases, it's from our diet. All right. And so we're going to get to that now. Before we do that, though, this here is Eric Adams, and he has a very fascinating story. Eric Adams is the president of the Brooklyn Bureau there in New York. And he, in 2016, he noticed that he was having vision problems. He also had tingling in his hands and his feet. But like a lot of men, he decided to suck it up. But then he went to a trip to Israel where he started to get some excruciating pain in his abdominal area. And basically doctors diagnosed him with a stomach ulcer. However, he was also very concerned about his blood work, which suggested that he had type 2 diabetes. His hemoglobin A1C, which is a marker of blood sugar control, was in the high teens. All right. Now, to get diagnosed with type 2 diabetes, it's about 6.5 and above. This guy was in the high teens, which is really, really high. Pretty much, this guy was in serious condition. And he went to several doctors, and they all said that he should take insulin, and that his diabetes was hereditary, it was because of genes, and that his tingling in his hands and his vision issues and stuff was permanent. Pretty much, there was really no way out. So he went on Google and he typed in the words reversing diabetes, and he discovered this documentary, Forks Over Knives. Okay, and he watched it, and he was stunned by the information that he saw, and he took copious notes. In this documentary, the doctors recommend that you go on a whole foods plant-based diet. So less processed food and cut out all animal products. And basically, this is what he decided to do. He cut out all oil, flour, cake, cookies, chips, and he went fully plant-based. All right. And the results that he got were amazing. In 3 weeks, his vision cleared up. In 3 months, his hemoglobin A1C dropped to 5.7, which is absolutely stunning. All right. His tingling disappeared, and in fact, and his blood pressure and cholesterol also normalized as well. Right. This is him when he had the type 2 diabetes. I'm going to show you now a picture of him, of what he looks like now. Okay, as you can see, a massive transformation. All right, not just exteriorly, but also interior as well. He says about his journey, at the heart of it all was my diet. My plant-based diet is the #1 reason that my diabetes was put into remission. All right, so his story is just an example of how you can actually heal from type 2 diabetes. I hope that this is encouraging to everyone. So if you have a loved one, family member, or even yourself, if you have type 2 diabetes, there's hope that it is potentially reversible. All right. Now, myth number 3 is that meat is not the problem. When you often hear conversations about type 2 diabetes, it's always about the carbs, right? Carbs. And really not much people talk about the meat, but there's actually good scientific evidence to suggest that meat might be an issue. All right, so let's take a look here. Here, this is a study done on the Seventh-day Adventist population, and you can see here, you see the 1 on the graph, the 1 on the left side. Above the 1 means a higher odd of getting type 2 diabetes. Below the 1 represents lower odds. All right. The reference group here is non-vegetarians. Okay, people who eat meat and there's no restrictions. Okay, as you can see, vegans, lacto-ovo vegetarians, pesco vegetarians, and semi-vegetarians, they all have a lower odds of of being someone who has type 2 diabetes compared to those who are non-vegetarian. Okay, so this is very interesting. You always hear is about the sugar and the carbohydrates, but you can see in this study, which involves tens of thousands of subjects, those who eat less meat actually have there's lower odds of them actually having type 2 diabetes. All right, here you see some graphs here. You see on the deck A, okay, dietary protein. Okay, you can see here at a certain point, more protein consumption actually results in increased risk. You can see the red line, red arrow goes up, increased risk of type 2 diabetes. That's very interesting. You don't hear about protein and diabetes, right? But you can see here, protein consumption at a certain point, more protein actually results in increased risk. Now, what type of protein? Well, you can see on deck B, you can see graph B, animal protein. Pretty much, even low amounts of animal protein, you can see the arrow goes straight up, the line goes up. That means increased risk of type 2 diabetes with animal protein consumption. On the other hand, you see C, graph C, you see the arrow goes down. Okay, that means lower risk with what? Plant-based protein. All right, so animal protein consumption, with animal protein consumption, the risk goes up. But with plant-based protein consumption, the risk actually goes down, which is very fascinating, right? So animal protein is actually an issue, which needs to get talked about, but it often does not. Red meat, you can see the arrow goes up. It's pretty much a straight line up. That means increased risk, right? And processed meat, you could see here as well. It goes up, okay? And even chicken, all right? There's at a certain point it goes up. All right, so really animal consumption is an issue. All right, and these are more things showing that. Okay, now processed meat particularly is a major issue. You can see here, even 1 to 2 servings per week. This is not that much, right? There's just 1 to 2 servings per week. All right, you can see almost over 100% increased risk of type 2 diabetes. All right. So why is that the case? I never heard of this before, right? Meat consumption linked with type 2 diabetes, right? So why is that? Well, type 2 diabetes, meat consumption has components that can adversely affect type 2 diabetes. So for example, it has a lot of saturated fats, advanced glycation end products. So advanced glycation end products pretty much when you add sugar molecule to DNA, to proteins and fats and so forth, right? And that is actually very toxic within the body. It promotes inflammation. Heme iron. Everyone here probably heard like, oh, heme iron is better than non-heme iron. This is why animal foods are better because you get heme iron and heme iron is better. Well, actually, that's actually not true. There's some truth, but actually not the full picture. Heme iron is actually a pro-oxidant. All right, so what does that mean? It promotes oxidation. It promotes inflammation. All right, so too much heme iron is actually not great. And when you get inflammation in the body, particularly in places like the pancreas and in the liver, then you can get dysfunction, which then leads to things like type 2 diabetes. All right. So when people are eating lots of meat, lots of animal foods, they're getting lots of heme iron, lots of saturated fat and so forth. And these things promote inflammation in the body. When you have too much inflammation, you get dysfunction. All right. And then the metabolic processes start to fall apart. All right. So meat needs to be talked about, and it is a risk factor. All right. Now, myth number 4, carbs causes diabetes. All right. So this is very interesting when people say that. When people say that, you have to ask the question, what carbs? All right, because every single thing you see here in the picture before you is a carbohydrate. The broccoli is a carbohydrate. The squash is a carbohydrate. The fruits are carbohydrates. The carrots are carbohydrates. Even Brussels sprouts are carbohydrates. Of course, the bread is a carbohydrate as well. So when people say, carbs causes diabetes. Well, did the Brussels sprouts cause diabetes? Did broccoli cause diabetes? Of course not, right? That doesn't make any sense, right? So to just categorically say that carbohydrates causes diabetes is really quite flawed, right? Now, of course, people mean, okay, well, people say, you know, what we mean is the grains, right? Is the bread, is the rice, and stuff like that, all right? But is this actually true? If you look here, okay, whole grains, okay, so you see on the graph the number 1, okay, below the 1 means lower risk, okay, above the 1 means higher risk. As you can see with whole grains, the risk of diabetes is actually lower, okay, it's actually have a decreased risk of diabetes. On the other hand, on the right, you see a graph with refined grains. Refined is like processed white bread, croissants, donuts, and things like that, right? You see an increased risk, all right? The line goes above the 1. So really, it actually depends on the type of grain. So whole grains lowers the risk of type 2 diabetes. Refined grains increases the risk of type 2 diabetes, all right? So there's a massive difference between refined grains and whole grains. So for example, there's a massive difference between corn and corn flakes, right? Corn flakes is highly refined and they add sugar, I believe, and it's very processed, right? That's very different from eating corn on the cob, all right? Or oatmeal versus oatmeal cookies. There's a massive difference here, right? Oatmeal is a whole grain, and if you eat oatmeal with no added sugar, that's gonna have a different effect than oatmeal cookies, which is highly processed and they add tons of sugar and so forth. All right, or a whole grain bread versus a croissant. They're both made from wheat, but it's very different, right? Whole grains have a lot of fiber, whereas refined grains do not. So whole grain bread has 5 grams of fiber, for example. Refined grains has 0, okay? And fiber helps slow down the release of sugar into the bloodstream. So you don't get that massive sugar spike as you would with refined grain, all right? And the grain characteristics are very different. So you see here, this is basically the basic components of a grain. You got the bran, you got the endosperm, and you got the germ. All right. And when you process a grain, you get rid of the bran, which is where most of the fiber is, and you get rid of the germ, which is where most of the nutrients are. You're just left with the endosperm. All right. So, but on the other hand, when you eat whole grains, you get the whole package. A lot of fiber, lots of nutrients. All right. So do carbohydrates matter? Yes, they do. Right. But it depends on the type of carbohydrates. That is really what makes the difference. All right. So if you're eating a lot of donuts and cookies and chips and white bread and stuff like that, that's not good, right? But if you're eating whole grains, whole grain bread, um, whole brown rice and stuff like that, you really don't have that much of a risk of getting type 2 diabetes, at least in the grand scheme of things. All right. Now moving on here, the second last one is fruits. You know, people say fruits are a problem, right? But that's actually not true. Fruits have a lot of fiber. They do have a lot of sugar, but it's natural sugars with a lot of other stuff like fiber. So when you add fiber to the mix, it actually is actually not as problematic as people might think. All right, so you can see here, again, the line goes below the 1. Okay, so you see the 1 here. Below the 1 means lower risk. So fruits tend to be associated with lower risk of type 2 diabetes. All right, and the last one here, before we get to your questions, is myth number 6, which is conventional recommendations are the most effective. All right, so when you have type 2 diabetes, a doctor might tell you, just eat healthier. And what does that mean? Well, just eat less processed food. You don't have to cut out the meat, just eat less meat, and things like that. All right. Whereas we in lifestyle medicine, generally we promote a completely whole foods plant-based diet, which means less processed and completely take out animal foods. All right. So which is better, a more moderate approach or cutting out all animal foods? All right. Well, if you ask the American Diabetes Association, this is what they say on their website. All right. You notice here, they say lean meat and plant-based sources of protein. All right. So they acknowledge that plant-based proteins is good, but they don't recommend going fully plant-based. They say, you could choose lean meats. All right. And in fact, it's very fascinating when you go on their website, they actually have a section where they have recipes and food recommendations for people with type 2 diabetes, and very interesting the type of foods that they recommend. So you see, if you go on the website, they have this type of stuff: ham and spinach sandwich, baked eggs, scrambled eggs with sautéed shrimp, ground beef meatballs, pork tacos, and so forth, barbecue chicken, and more meatballs and roast beef and things like that. All right, so the American Diabetes Association, which is recognized as a very reputable organization for diabetes, they recommend, you can still eat meat and stuff like that. Just probably eat less meat, but you don't have to go full on plant based. So who should we believe here? The plant-based group or the American Diabetes Association, which is a very reputable organization? Well, we don't need to guess. Scientists have actually compared the American Diabetes Association recommendations with a fully plant-based diet. All right, I'm going to show you studies that show that actually going plant-based is actually really the better way to go. All right, so here they studied a lacto-ovo vegetarian diet with a conventional American Diabetes Association diet. Okay, so a healthier diet, but not fully plant-based. Whereas here, this one is a plant-based diet that includes eggs and dairy. All right, so here green represents plant-based, black represents the conventional diet. Okay, so as you can see here, the plant-based group is doing a little bit better. All right, again, you can see here, they are doing better. Now, what if you cut out the eggs and the dairy completely? So you go fully plant-based, no eggs, no dairy. All right, well, this is studies by Dr. Neil Barnard and colleagues, which shows that a plant-based diet, a low-fat vegan diet is what they call in the study, does much better than just simply following the American Diabetes Association recommendations. So the green line represents vegan, low-fat vegan. The black line represents a conventional, healthier diet. All right. So you can see here, the results are much better on a fully plant-based diet. Okay. Again, you can see here, same thing. Okay. The green line drops lower. They do better. This is a Korean study. This is one of my favorite studies. A Korean study comparing a vegan or plant-based, rice-based Korean diet compared to the Korean Diabetes Association recommendation, which is pretty much the same as the American one. All right. So you can see here, green represents plant-based or vegan if you want. Black represents American Diabetes Association. You can see here, just following conventional recommendations gives you really mediocre results. Whereas if you go fully plant-based, you get tremendous results. You can see here the hemoglobin A1C is 6.6. They're just pretty much 0.1% away from, 0.2% away from reversing or getting out of the diabetes range, at least when it comes to blood work. All right. So in closing, I want to share with you a story here. This is Joseph Benning. All right. And Joseph Benning he grew up doing triathlons and stuff like that. He ate healthy and he exercised a lot. His sports nutritionist and registered dietitian recommended that he eat chicken and fish and occasionally red meat, but lots of salads and fruits. But at the age of 55, despite his quote unquote healthier eating and exercise patterns, he was diagnosed with type 2 diabetes at the age of 55. When he asked the doctor said that it was normal for people of American Indian heritage, he's indigenous, to have type 2 diabetes appear at the age of 55. And so he said, this is basically due to genetics, and that's why you get it. All right. He went on the American Diabetes Association website and he realized, because he wanted some advice from the American Diabetes Association, and he realized pretty much he was doing everything that they're telling him to do. So he decided, okay, since I'm eating healthy anyways, I'm going to ramp up my exercise. But even despite that, years later, he's still diabetic, still was not able to get his blood sugar under control and so forth. Okay. Then someone told him about the documentary Forks Over Knives. And I want to recommend to everyone, if you have not seen Forks Over Knives, that you go and check that out. I think it'll be quite eye-opening for you. He went to Forks Over Knives and he watched the documentary, which told him a different perspective. Instead of just cutting down on meat, you just cut out meat completely and cut out all animal foods, go whole foods, plant-based. And he watched it, and he says here that it infuriated him. And he said, for years I had done all that the medical professionals instructed me to do to combat my diabetes, only to find out that I had been misinformed. When he went on a fully plant-based diet, in 2.5 months, his A1C went down to 6.5, which is pretty much at the cusp. Right? It improved drastically. Okay, and today he is diabetes free. All right, so it tells you the benefits of going on a whole foods plant-based diet. All right. So in closing, today's medical system, when it comes to diabetes management, it looks something like this. Doctors who are just merely mopping up the symptoms, all right, instead of addressing the root cause. When you have an overflowing sink, you don't sit there or you don't stand there just mopping up the water, right? You're supposed to turn off the faucet, right? That's the cause. But when it comes to in the experience of many individuals, they're just being told to take medications that merely are just addressing the symptoms, really not the cause. When we eat a whole foods plant-based diet, in many cases we're actually addressing the root cause, and this is why people find tremendous results when they switch to that dietary pattern. And we see this in clinic as well. When people switch, they get off their medications and they're able to manage their blood sugar really well. And this is not just anecdotal, as I've shown you today, is backed by science. So when it comes to diabetes management, I want to encourage everyone here to think outside the box, literally outside the box, right? Now, it's not to say that you should stop taking your medications. It's not to say that drugs aren't important. Of course they are. Do drugs have an important role in medicine? Of course they do, right? They've done a lot of good. So this is not to bash pharmaceuticals and so forth, right? You should cooperate with your medical doctors and your naturopathic doctors and your other healthcare providers when you're dealing with your diabetes. But what we are saying here is that there's scientific evidence to suggest that really it's the lifestyle habits that is really behind this really devastating disease. And when we make positive lifestyle changes, we can see really positive results. All right. So I want to submit to you today that when it comes to type 2 diabetes, that healthy nutrition, specifically a plant-based diet or plant-based eating pattern, is primary therapy. Medications and supplements and herbs and whatever else, this is adjunct therapy. Adjunct is a medical term, or it's a term that means add-on. All right. In the experience of many patients, they're pretty much the impression that they get is that the medications are primary and lifestyle is kind of like add-on. But I think we have to switch it. I believe that based on the science, that lifestyle patterns, healthy lifestyle patterns, is actually the primary therapy, and medications should be the adjunct. All right. So they're important, but they shouldn't be primary. Lifestyle factors are actually the primary. All right. And so I want to leave that with you. I hope that gave you some food for thought. And with that, Daniel, I think we'll take some questions.
All right. Thank you, Dr. Cho. That was a great presentation. Thank you for your questions. Let's try to get through as many as we can. And just we have a few minutes left. So we have a question from Sarah Bautista. Thank you for joining us. Any studies on white rice or potatoes? I know that rice and especially potatoes might be a bit controversial in nutrition. So any thoughts on that as it relates to diabetes?
Yes, I seen one study that shows that white rice intake seems to be associated with increased risk of type 2 diabetes. All right, I do not have the reference on hand, so I apologize, but I have seen that white rice intake can be associated with increased risk, which kind of makes sense. It's a refined carbohydrate. Now, the study I talked about before, the brown rice study from Korea, right? That was based on a brown rice plant-based diet. All right, so we want to encourage everyone to try to switch to brown rice, which is a more of a whole grain. All right. Some people have a hard time eating brown rice because it's kind of like a little bit chewy and stuff like that. My wife, what she likes to do is she likes to mix white and brown. So she puts more brown and puts a little bit of white and kind of like makes it a little bit easier. So maybe that will help people to transition. Now with potatoes, I can't comment specifically on potatoes. Haven't seen a study, but I think we have to really make a distinction here. Um, there is a massive difference between baked potatoes, even if they're white potatoes, versus like French fries, right? So I think we have to really make. If we just say potatoes are bad, categorically, I think that's a little bit of a mistake. Now, if somebody has uncontrolled, like very, like their diabetes is really, really serious, then yeah, maybe you want to stay away from potatoes until you can kind of get that a little bit under control, right? But to just categorically say that potatoes are bad, I think is really, really a little bit misleading. There's many different ways to eat potatoes, and you can eat it in a healthy way, and you could eat it in an unhealthy way. I think we have to really make that distinction.
Okay. Thank you. We have a question from Andra. Andra, thank you for joining us. It's a question about gestational diabetes. Why does it occur when there is no problem outside the pregnancy? So I'm reading into the question. You know, they didn't have diabetes before, but then they get diabetes during pregnancy. Is it similar to type 2 diabetes? Any thoughts on that one?
Yeah, that's a great question. It's interesting you asked that. My wife is actually pregnant right now, and she has gestational diabetes. So we've kind of gone on this journey right now. So I just to the best of my knowledge, gestational diabetes is actually not really caused by lifestyle factors. It actually during pregnancy, some people produce a hormone which kind of which impedes some of the insulin signaling. And so this is why people have gestational diabetes. It's not really due to poor lifestyle habits. So somebody like, for example, like my wife, she's plant-based and everything, but then she got gestational diabetes. She's not overweight. She's actually quite thin, right? And she's eating quite healthy, but she got gestational diabetes, right? So maybe that's encouraging to you that it wasn't really your poor lifestyle habits. It just it's a different factors from your pregnancy. And so we want to encourage everyone, you know, if you have gestational diabetes, eat healthy, right? But maybe you have to maybe cut down a little bit on some of the carbohydrates in this particular situation, right? So my wife, for example, she's finding that, you know, that she reacts really strongly to fruit. Before she was eating fruit just fine, but because of the gestational diabetes, her blood sugar actually shoots up quite significantly when she's eating fruit. So she's had to not completely eliminate, but just kind of like tone down a little bit on the fruit intake and so forth, and maybe up the protein and so forth. So, so yeah, I hope that answers the question.
Okay, thank you. We have a question from Marlu. Thanks for joining us. I'm 64 now. Is it too late for me? I guess is referring to diabetes. He or she also says, I was able to omit salt because I have a high blood pressure.
Right. Everyone's a little bit different. I don't think age 64 or whatever, I don't think that's too late. I think that's not too late for sure. But it really depends on your personal history and also what you're doing now, right? So if you're going to make those lifestyle changes like we discussed today, I don't think it's too late, you know. But if you're not willing to make those changes, then um, then then yeah, the chances are not that great. So age 60 is 60, 64 is not just definitely not too late. Yeah.
Okay. And just on the gestational diabetes question there,
Sorry, Daniel, I think you cut off a little bit. Could you repeat the question?
Gregory, that there's a comment from Gregory saying that pregnancy is an insulin-resistant state.
Sorry, Daniel, you cut off a little bit there. Can you repeat the question?
Yeah. Okay.
My apologies. Yeah.
Do you hear me now?
Yes, I do. It's
Yeah.
good now. Yeah. Sorry.
I'm just saying that we have a Gregory is just making a comment that pregnancy is an insulin-resistant state. Just referring back to the gestational diabetes question.
Okay. Yes.
Yeah. We have a question from Dina. How about the plant fats like avocado, olive, tofu, nuts, seeds, etc.? Are they concerned in terms of the intra-organ fat buildup?
Great. That's a great question. Thank you for the question. In the Neil Barnard studies that I showed everyone, they purposely put people on a low-fat vegan diet. All right, and so they told people to limit even nuts. All right. Now, and that's because what we talked about. We want to try to get the fat out of these cells. All right. So that makes sense. And Neil Barnard's studies show that a low-fat vegan diet can help in that process. Now, from our personal clinical experience, I haven't personally told people to go on a low-fat. Purposely told people to cut out like avocado and nuts and stuff like that. I told them to eat those things in moderate amounts, right? And we still see very good clinical results. People get off their medications and the hemoglobin A1C normalizes and so forth. So I think what I'll say is this: if your type 2 diabetes is really very serious, then yeah, you might have to take more drastic measures. All right, but if your hemoglobin A1C is like slightly above the normal, you're kind of like in the lower range of it's not too bad, but you still have a type 2 diabetes, then you might be able to get by with still eating some avocado and nuts and stuff like that. So it really depends on your particular situation. Okay, I think that's what I would say with that.
Okay.
But generally, it's not an issue, generally speaking, but
okay.
you have to like look at individually, right?
Okay, great. And I think we're at 6, so we're going to close up here. Maybe a final question from Vivian. Thanks, Vivian, for joining us. Should diabetic eat banana and apples, and how many? Any thoughts on that?
Yeah. Personally in clinic, we told people they always ask this question, especially bananas. They always ask about bananas and stuff. We told them it's fine, and again, I think it's because of the fiber and so forth, right? So we tell them, you can eat fruit, and we don't restrict them really, and we see they reverse. But again, I think it goes back to what I said before, that it really depends on your current states. If your diabetes is really, really uncontrolled right now, and then maybe you have to consider maybe choosing lower glycemic index fruits, right? So that might be something that people have to consider. Also, I like what Dr. John Kelly says. He says, if someone is not willing to make the lifestyle changes, all right, so they're not willing to cut out the animal foods and so forth, and so then their diabetes is still quite uncontrolled, you're not dealing with the root cause, then yes, fruit becomes an issue because you're not really making the lifestyle changes needed, right? So yes, in that case, then yes, please choose lower glycemic index fruits or limit your fruit intake if you're not willing to make those lifestyle changes. But if someone's willing to make those changes of whole foods plant-based diet and make the total change, then generally in that situation, fruit is actually not that much of an issue. Okay, so that's what I would say about that.
Okay, great. So we are past 6 now, so we want to respect everyone's time. So just really want to thank everyone for joining us. Thank those who are watching on Facebook. I just want to really thank the Berea Seventh-day Adventist Church for partnering with us on this. I want to thank Linda for being with us and introducing. So thank you, Linda, so much. Linda, did you want to say any final words? Or?
Yes. Just to say thank you for presenting and for hosting this afternoon's session. And the information was really informative and quite in line with our principles of healthy lifestyle and plant-based diet.